Hello, everyone. Welcome to Kiwi College and our Moms Meet webinar on xylitol. I'm Sarah Smith, the editorial director of Kiwi, and I'm very pleased to introduce you all to our expert speaker today, Angie Stone. She's a registered dental hygienist and the editor-in-chief of Hygiene Tribune, and she educates and trains people around the world. So we are so lucky to have her expertise today. She represents our sponsor, Clear, which is the leading manufacturer of 100% xylitol sweetened products. At the end of her talk today, she'll be answering questions, so feel free to type them in and send them at any time, and we'll get to as many of them as we can. I'm really looking forward to learning about xylitol today, so I'm going to turn this over right now to Angie. Thanks so much for being here.
Thank you, Sarah. Thanks for the great introduction, and thanks to all of you who are logging in today to learn about xylitol. It's truly an amazing natural substance. So let's, without any further ado, get moving on here. You'll see on the screen outcomes, and basically what we hope that by the end of our time today you'll be able to basically answer this these questions. And so let's go. What is xylitol? Well, xylitol is a natural occurring sugar substitute, and that's the verbiage that I like to tell people, because many times people will think that this is something that is manufactured or that is not natural. But it is a natural occurring sugar substitute, not an artificial sweetener. And it's been around a really long time, since like 1891. So it was just a couple days ago, right? It was founded first by a German chemist named Emil Fischer, and it was discovered about the same time in Finland. Xylitol is considered a sugar alcohol. That doesn't mean that it has alcohol in it. I get that question a lot. It's just what the chemists have given it for a chemical name. It is different than sorbitol and mannitol because xylitol has a 5-carbon structure instead of a 6-carbon structure. So that structure is what makes xylitol amazing for the many health benefits. It's that 5-carbon structure that confuses the bacteria that lead to dental decay and that lead to upper respiratory infections. What happens is the bacteria that cause those kinds of things ingest the xylitol, but they don't know what to do with it. And so they can't digest the xylitol. So the reason that we get infections is because the bacteria can survive, and without any excretions they can't stick. And so if they're not sticking to us, they can't make us sick. So it is important to know that it's a 5-carbon, and that's where the magic happens. We extract xylan from plant fibers, and then water's added, and then there's some hydrogen combined with the xylan, and then we get xylitol, which is a sweet crystalline carbohydrate, and to the naked eye you really can't tell much difference between the xylitol and sugar. As I alluded to a couple minutes ago, xylitol is not created in a lab, and it's found in many plants and fruits and vegetables. So depending on our diet, we consume several hundred milligrams of xylitol a day from our fruits and vegetables. And in fact, xylitol is so important in our metabolization process that the human body will create about 5 to 10 grams of xylitol a day to be sure that the body has enough xylitol. Large-scale production of xylitol became practical in 1970, and the first chewing gum sweetened with xylitol was launched in Finland and the United States in 1975. Again, this isn't anything new to the world. We've had it a really long time. Now we have ways of getting xylitol that are more efficient and economical, and the most abundant source right now are corn cobs. It's not the corn, it's the cob. And so that's important to know, because people will ask me if people with corn issues, they think that they can't have xylitol, and that's absolutely not true. As you see on the screen there, we can also get xylitol from birch bark. But of course, corn is a more renewable source, and there's obviously more corn in the world than there is birch bark. So why do people like xylitol so much? What are some of the benefits of xylitol? Xylitol is as sweet as sugar, and we can substitute it 1-for-1. It's really neat because it has 40% less calories than sugar, and we can cook with it. It's not good though for baking things that need to rise. So in the picture there, you'll see that that cake is layered. The xylitol doesn't react like the sugar does. Again, remember the 5 carbons versus the 6 carbons. So things tend not to rise. So it's really good for cookies and brownies. It's great to sprinkle on our fruit, in our coffee, in our tea, in our cereal. It's great for those applications. Xylitol is also good for diabetics. It doesn't have much effect on the insulin release, and it's also, because it has 40% fewer calories than sugar, it is good for those people who want to lose or maintain their weight. Xylitol is also useful for upper respiratory problems. We know that xylitol has been shown to inhibit the growth of certain bacteria, and it is useful in preventing middle ear infections in children. So this is a picture of a middle ear, and what happens in ear infections is the inflammation of the tissues based upon the bacteria that's in the tube causes the eustachian tube to close up, and that's when the infection will start. This is particularly important to understand in children, that their tubes are about ½ inch shorter and they lie more horizontally, as you can see in the picture. And so the fluid doesn't have a chance to really move through those tubes very well. As we become adults, the tubes triple in length, and so we can transfer the liquid more easily. So if we can put xylitol into the sinus passages of our children, it will inhibit the bacteria from sticking in those tubes, and it can help to prevent ear infections. The xylitol nasal wash that Clear has is amazing because it doesn't include any drugs, it has no side effects, it's safe for everybody, and it's non-habit forming. The nasal spray has a few mechanisms of action, and one of these things is to decrease the adherence of the bacteria, and it stimulates our own defense system. It also decreases the concentration of salt, and that's important in fighting infections. The best way to utilize the nasal spray is to use it daily and not just when you're thinking that you're feeling sick. And so Dr. Jones, the inventor of the nasal wash, says that when you wash your mouth, you wash your nose. So when you brush and floss your teeth, you would use the nasal spray, and 2 squirts into each nostril in the morning and the night, used preventatively. As Sarah said, I'm a dental hygienist, and so my love for xylitol came when I found out that we can help to decrease tooth decay by the use of xylitol. And what we know, again, what I already stated, is that the xylitol helps bacteria from sticking. And in order to get cavities, the bacteria has to stick to the teeth and create what we call a biofilm. And then the bacteria that's in the biofilm are what breaks down the tooth enamel. So when we utilize xylitol, it can prevent the bacteria from sticking, and they're simply washed away, much like they are in the nasal passages. This is so interesting to know that children are not born with the bacteria that cause decay. The causing bacteria of decay are the Streptococcus mutans, and babies don't have those in their mouth when they're born. We give them to them, particularly their caregivers or their mothers, because those folks will test their food for them, make sure it's not too hot, and so we put it in our mouth, and then we put it into the baby's mouth. So we are vertically transmitting the bacteria, the Streptococcus mutans, into the mouth of the child. And if we have xylitol in the mouth of the babies, then when the Streptococcus mutans are introduced, they won't stick to the erupting teeth. And so on the slide there, let me just explain this a little bit. There's a pacifier that you can see there, and the back end of the pacifier opens up, and then you put this tooth gel in the back end of the pacifier, and it's a delivery system. And so you would have the baby suck the xylitol out of the pacifier a couple of times a day. We're not advocating that the child suck on the pacifier all day long. It's simply a delivery method. And I have had moms tell me that they love it because they can also give the child any other medications that they might need and have the child suck those things out of the pacifier. So this is a really neat way to get the xylitol into the baby's mouth. We need to keep our eyes and ears open for other things coming along about xylitol. They are finding that it increases bone calcification in older rats, and they continue to do research with that, so we're hopeful that we will be able to increase bone calcification in humans. And they're also experimenting with xylitol in wound healing. We have chronic wound infections or chronic infections in wound care clinics across the country, and particularly in our diabetic folks who might have an infection that they can't get to heal. They are infusing bandages with xylitol, and I believe it's lactoferrin, and they are getting some really good results with getting those wounds to heal. So that's coming up too. So watch and listen for what more exciting things are going to happen with xylitol. So we've done a basic overview of xylitol, and let's talk a little bit about who can benefit from xylitol. Now this is talking about the dental benefits, and it's much the same in the sinus cavity. Basically anybody who has teeth, consumes fermentable carbohydrates, and has the strep mutan bacteria in their mouth, they can all benefit from the oral use of xylitol. And basically anyone can utilize the nasal wash and get the nasal benefits as well. So how should we use xylitol? We used to specifically instruct people to get a certain amount of grams a day, but this became a little bit cumbersome because people would be flipping packages and trying to keep track of how many grams they had a day. The research shows us that we should have approximately 5 to 8 exposures to quality xylitol products throughout each day. We know that the benefit starts at 3 exposures. And so what we like to say is strive for 5. 5 seems to be the lucky number when we're talking about oral health and xylitol. So this is easy to do, and when I'm talking to my patients or educating other dental hygienists, I recommend that the person uses toothpaste and mouthwash sweetened with xylitol in the morning. Using both of those together is 1 exposure, and then we would repeat that again in the night, and so you would have your 2 exposures of your toothpaste and mouth rinse, 1 in the morning, 1 in the night, and then all we need to do is chew a quality xylitol product for 5 minutes after each meal, and this can come in the form of gum or mints or candies. So if you do that after breakfast, lunch, and dinner, then you have your 5 exposures. This is an interesting fact. The United States Army is putting xylitol in our soldiers' meals while they're deployed in their MREs. And they're doing this because there is no access to care in the dental field. And if our young men and women who are in the field suffering from a toothache, they can be laying in their bed all day, and that's not really helping their mission. So the Army is trying to get these young people to have xylitol at least 3 times a day, so it's packed in each of their meals. They're also beginning to put gum in what we deemed chow halls. I was in the Navy for 5 years, and so you'd go through the chow hall line, and at the end of those lines now currently they're adding xylitol gum, and they're also putting them in their theaters. So that's amazing to me that the government is on board with xylitol. If you decide that this webinar today was so informative that you want to transfer all of your sugar out for xylitol tomorrow, you might have a little bit of time where you need to get used to that. As I said, we have xylitol in our diet, but we're not used to a huge amount of xylitol at one time. So if we pump up the amount of xylitol in our diet quickly, we can have some laxation effects. You can see there that the laxation threshold is reached typically at about 45 grams in a child, and in the average adult, approximately 150 to 200 grams a daily. The recommended dosage for oral and nasal health and middle ear infection health, middle ear health, we're not recommending that much at all. And so typically, with the levels that we're recommending for oral and sinus health, people do not have any side effects. So where can we get these kinds of products? As a dental hygienist, I know that dental hygienists across the country are getting on board with the use of xylitol for their patients, but they're not telling their patients the whole story. When patients ask where they can locate xylitol, many times the answer is to look for xylitol in gum. That's not the best answer. A lot of companies are getting on board with xylitol, and what's happening is they're putting a little splash of xylitol in the product so that they can say they have xylitol. What we want to do is what the Army has deemed, look for xylitol first. Just like on this label that I have here on the screen, the xylitol is the first ingredient, and the research has shown us the most benefit comes when the product is sweetened only with xylitol. Some of the other sweeteners that are 6-carbon actually feed the bacteria. So we want to keep all of those other items out if we're interested in utilizing the benefits of xylitol. So again, look for xylitol first, and xylitol should be the only sweetener in the product for the best oral benefits. And what we need to do is we need to find these kind of products at health food stores across the country. Mass market is not carrying xylitol products that are meeting the requirements that are necessary to give us the benefits of the xylitol. So visiting a local health food store will give you quality products, you'll be able to locate them, and you'll have a variety of things that you can choose from. But again, these products aren't typically available in mass market at this point in time. That's why I am a Spry fan. As Sarah said, I do represent Clear, and I do that because I have used these Spry products with my patients well over 5 years now, and the benefits that I see them gaining by using these products is absolutely phenomenal. I've also done some small-scale research with xylitol in a nursing home, and I can't explain to you how amazing the benefits have been. And so that's why, first and foremost, I'm a Spry fan, because I am a dental hygienist and I have seen how well these products work. That is it for my presentation. It's short and sweet. We could certainly spend a lot more time delving into this, but what we're going to do right now is I am going to see if Sarah has fielded any questions from you all, and then she can let me know.
Great. Thank you, Angie. That was really informative. And we are getting some questions coming in. And so, so folks, feel free to send in more if you've got them. One of the first ones that came in was someone who said, you mentioned that xylitol is good for upper respiratory infections. So she wants to know, is it also good for a child who suffers from asthma or hay fever allergies, like ragweed and grass, that kind of thing?
We have heard lots of people, many people, that have told us that they do benefit from keeping the nose clean of the allergens. I'm not really wanting to speak about the asthma so much. I don't really have any information in my head about the asthma. But if that person wanted to, she could certainly email me. My email address is on the screen there. And what I will do is I will get an answer to that question for sure from the people at Clear. But we do hear many, many times over that this is helpful for allergens, just again, to keep the nose and the sinuses free of those contaminants.
That's great. Okay. We had a question about the nasal spray for kids. Is it, someone who's a little nervous about using it? Is it okay for kids? Is there danger of damage to the nasal system after extended use? I mean, I know you talked about using it preventatively, so it sounds like you use it a lot. Can you speak to that?
Sure, absolutely. As I mentioned, there is nothing in the product. It is simply, and maybe I didn't mention this, it is saline, xylitol, and a little bit of grapefruit seed extract for preservative. So there is nothing in that product that is not 100% natural. And so prolonged use is not a problem because it's not habit forming. There's nothing in there. And I know some people who have issues will be put on medications that they can only use for a short amount of time. And so I think that's where the train of thought comes from. But this is 100% natural, and so using them in a child or an adult has no side effects.
Does it have any potential irritation in the nasal passage? I think that's another thing that she's concerned about, the actual,
irritation.
Yeah.
I don't know of any irritations. I've been using this product for, like I said, well over 5 years. I have many family members that use it, lots of patients that use it, and I really don't know of any irritation of the sinus passages.
And how about age of kids? How old should kids be when they start using that?
They can use it as soon as they're born.
Okay. Well,
and what we would do with children is the delivery system comes in 2 ways. It comes in just a squeeze bottle where you would squeeze a mist, or it comes in a bottle that is more like what you would see maybe a prescription medication come in with. It has the pump on the top. And in a small child, what we recommend is that you don't squirt it into the nose. When you lay them back for a diaper change, you would just put a drop. You can use that squeeze bottle as a dropper as well. And so you would put a drop of the fluid in each nostril at each diaper change. Do that before you start the diaper change so that the child can lay back for a little while after you administer it.
Okay. Are there any other side effects from the ingredient? Someone said that some artificial sweeteners make her feel nauseous. Have you had any reports of anything like that?
I have not. There are some people that tell me that they can't tolerate the xylitol, but again, they're eating xylitol every day if they're eating fruits and vegetables. Okay. And so this is not something that the body's not used to. Like artificial sweeteners, obviously we have no idea, our body really doesn't know what that is because we are putting things together and that really haven't been put together in nature, and so that can cause some issues. There are some people, not very many, they're few and far between, that tell me that they have some issues with xylitol, but again, it's a natural substance and we're already consuming it.
Okay. You talked about chewing the xylitol sweetened gum after eating. Is there a particular window of time that's most effective?
What we recommend is after each meal, and the reason for that is twofold. Number one, to get the xylitol in there, and number two, to increase the pH of the mouth quicker after we eat. When we eat, the pH in our mouth drops to an acidic level, and it takes our body about 20 minutes to get that pH back up to where the teeth aren't going some what we call demineralization. And so doing it after meals helps increase that pH quicker. But I will tell you that I have many, many people, and when I did my research project, these people didn't even have it in conjunction with their meal times. They were just having it spaced out throughout the day, and they were still receiving a benefit.
Oh, okay. We have a question from someone who wants to help protect her son from ear infections, and he's 2. So can you go back to how often and how much should be used in that preventative? And then can you also address, someone else was asking about, so we know about preventative, does it also treat? And do you use a different amount when you're treating?
Okay, so preventatively, again, the train of thought is you wash the mouth, you wash the nose. So we should be, ideally, brushing the teeth 3 times a day, ideally. And so you would put the nasal wash into the nose in the morning, noon, and night in order to help prevent the ear infections. I know that people have only done it morning and night, and that seems to be helpful as well. But if you want to really jump on the bandwagon and get the protocol going, I would do it 3 times a day.
And now, and you're talking about the spray or the toothpaste, right? Does it have the same benefit for the nasal passages and the ear infections if you're cooking with it or putting it in a drink? That was a follow-up. No. Okay, so that's sort of a separate reason to use it instead of sugar.
Right. So for orally in your mouth, for teeth and gum health is why we would use it. The gum, the mints, the sweetener, things like that. But the nasal particularly comes with the nasal wash, although there is some benefit with the oral use into the middle ears.
Okay.
Does that answer the question, Sarah?
I think it does, yes.
Okay, and then you asked me also about treating.
Right.
Obviously, it's best if we can prevent things. I do know people, though, that will use this when they're starting to feel sick, and they tell me that it flips them around more quickly than if they didn't use the product. But if you're already really sick, it might lessen the duration of the illness. That's my train of thought.
Okay. We have a question about where it comes from, that it came, a major source of it is corn, the cob of corn. And I know that GMOs are again, becoming a big concern for a lot of people. And someone did ask, do you know if the corn that xylitol comes from is genetically modified?
You need to know where the xylitol is coming from, what manufacturer. Clear's xylitol is all non-GMO.
Okay.
I can't answer for any other line of xylitol. I don't know.
Mm-hmm. We have a question about the spry toothpaste, about the flavors. Are there multiple flavors? Is it just mint, or are there others?
Well, we have 2 versions of mint, and please forgive me, I don't know. One spearmint and one is, I'm sorry, I can't answer the question about what kind of mint it is, but they are both a mint flavor, and one of them has fluoride, one of them does not, and so that's how, in my hygienist mind, that's how I differentiate them. So we just have 2 mint flavors, one that has fluoride and one that doesn't, and then we also have, for the children, strawberry banana flavor, and then we have non-flavored for the infants.
Oh, okay, great. A nice variety. Okay. Going back to cooking with it, is there a particular taste to xylitol? Does it taste, have an aftertaste or
no
taste of sugar? No.
There's no aftertaste, and it tastes just like sugar. It's simply amazing. It's so cool that this is just out there, and we're able to reap so many benefits from it, and it tastes really good.
Can you describe how it's granules, right? Because
it is.
Asking, can you just add it to coffee and tea?
Yeah.
It's just like sugar, right? It looks just
sure.
sugar.
Absolutely, and it comes packaged, like little, in the little single-serve packets. It comes packaged like that. It also comes in 1-pound bags, 3-pound bags, 5-pound bags. So depending on how you want to use it.
And you said earlier that it's not good for things that need to rise when you're baking, right?
Mm-hmm.
Is there any other things that that it's not great for, or is that the main thing?
That's pretty much the main thing.
Great. We had another question about that. And let's see, someone asked, when baking cookies, is 1 cup of sugar the same as 1 cup of xylitol? And it is, right? Did you say it's 1 to 1?
Absolutely. Yes, it's 1 to 1.
Right, that makes it very easy. You can just follow your recipes exactly then. That's good. It looks like we are just about out of time, and oh, you know what? Let's just address the gum. Do you mind telling us about, do you know the flavors of the gum? People are asking what the flavors are, and if there are more coming out, kid flavors, if you could address that.
That I do know. We have spearmint, peppermint, fresh fruit, and cinnamon and green tea currently, and I'm told there are going to be some more flavors coming out, but at this point in time they are trying to put a whole bunch of them together. I don't know which ones are going to be actually going to market. And I will tell you, in my opinion, the cinnamon is my favorite, and the children's favorite seems to be the fresh fruit.
Mm-hmm.
And if you are familiar with juicy fruit, it pretty much tastes like juicy fruit.
Sounds good.
And we also have candies that are called Sparks for children, and if you're familiar with the candy called Nerds, they're just tiny little candies. The Sparks are very similar looking to the Nerds, and they come in a plastic tube, and the kids absolutely love them, and you would give them 4 of the little Sparks after each meal.
Oh, great, great. We do actually we had one question about if you know or can address why more stores aren't carrying xylitol products. And then someone else asked, can you also buy them online, if you can't get to the kind of stores that you were talking about?
Yes, absolutely. You can purchase xylitol online, and if they would want to get the spray line in Clear, that's available at the website. Clear, it's Xlear, no C in there, it's Xlear.com, and there is all the products are available on the website. And to answer the question, why aren't more places carrying xylitol? A couple of reasons. Number one is people don't understand why they should use xylitol, and so we're working very diligently to get people to understand the benefits of xylitol. You will notice that if you chew xylitol sweetened gum, the flavor doesn't last very long, and that's because it's a natural flavor. And so in the mass market, where people are accustomed to chewing a piece of gum for the whole day and the flavor never going away, if they don't understand that this is what I like to call a therapeutic gum rather than a recreational gum, they're not going to repurchase it if they've not been educated. And also the xylitol is more expensive than other ingredients, and so that's why you'll see some people just putting a splash in and then calling it xylitol.
Interesting. That's very interesting. Well, I'm glad we are all educated on
yes.
the reasons for it now. Thank you. So it looks like we are, out of time, and thank you, everybody, for your great questions that you sent in, and thank you especially, Angie, for this wonderful information. I just want to remind everybody of that website, xlear.com, and also xylitol.org. Angie and I were talking about it before when we were getting ready for this. It's just a really wonderful resource, has a lot of really good information, and so I know Angie recommends that as well. So thank you, everyone, for being with us, and have a great rest of your day.